All right. Good early afternoon, everybody. We are here for our Team Kentucky update. And we'll start where we've now, thankfully, started numerous of these updates. More jobs. We have an economy that is on fire. We've already broken every annual record that can be broken. We have more investment, crossing over $10 billion of new investment this year alone. And in between Monday and today, we've had another jobs announcement. So earlier this week, again, we highlighted that incredible economic success. But yesterday, we announced that NEMAC USA Inc. will expand its NEMAC Kentucky operation in Glasgow. $27 million expansion. It's going to create 170 new full-time jobs. It's a common trend we've seen across the automotive industry, and that is preparation for the future, focused on electric vehicles. And that continues with this announcement in Barron County. Yeah, we talked when, thankfully, that Ford deal came through, when we were picked to work with Ford to lead that great company into the future, about how this prosperity could reach every part of Kentucky. Barron is seeing the movement. Barron is seeing that type of progress, new jobs in this movement towards electric vehicle. NEMAC manufactures innovative, lightweight products for powertrain, e-mobility, and structure applications. And this expansion will position the company to support future EV-related business. The best part of the company's growth, however, is the job creation. These are great jobs. So in Barron County, 170 new jobs thanks to NEMAC, with an average hourly wage of $35 an hour, including benefits. Also, the investment will further the company's training efforts for current and new employees. NEMAC works closely with South Central Kentucky Community and Technical College, as well as WKU, to train its employees, and it's great to see these partnerships take yet another step forward. This type of concerted effort to ensure individuals have the necessary training is crucial to our state's continued economic growth. So, an economy on fire continues to burn. I want to thank NEMAC for continuing this historic role that we are on. Again, Kentucky, right now, is the talk in every boardroom across America, and every country across this world now not only knows who we are and where we are, but what we can do. And it is not stopping there. We still have a large number of potential projects, many over the $1 billion mark, that there is some potential we could land before the end of the year, but certainly we'll be working on through next year. It's a special time. It's a time where we are getting so close to living out that dream that our kids will never have to leave our state or their community, because every opportunity isn't available to them right there. That is every Kentucky parent's and grandparents' dream. And it's really special to be this close and to know that our time is here, our future is now, and these are the moments we're going to look back on in 30 years and know they changed everything. All right, so it's been an incredible past week for Team Kentucky, and one thing we're going to try to do with these is to recap a few of the things that have happened during the week, because it's been busy. I had an opportunity to meet His Excellency, Mr. Koji Tomita, Ambassador of Japan to the United States. We discussed the country's longstanding partnership with our Commonwealth and how we can work together to build a bright future right here in Kentucky. See, Japan is Kentucky's largest international investor and the largest international employer, with an especially strong presence in Georgetown and in Lexington. More than 47,000 Kentuckians are employed by Japanese-owned businesses, and 200 facilities in Kentucky are operated by Japanese-owned companies. Obviously, Toyota was a huge moment in the history of our state when it located here. And last week, announcing a $470 million or a near $470 million expansion. Japanese-owned businesses continue to be a huge part of our economy. It was a special meeting. A special meeting because of the impact that Japan and its investment has had in Kentucky. But the ambassador also said some really kind things. First, he said that he was impressed during this pandemic that our state took every one of these and other updates and through some groups out there, translated them into Japanese, making them more available for all of their executives or workers. It was a good compliment because it shows that we look out for one another, every single individual in this state. That's what COVID shows us. We are all important and we are all connected. Second thing he said is how much Japanese executives love living in Kentucky. And that's really important for us because we believe that when people give us a look, which is now the reality, never a flyover state again, but when they give us a look, they realize they can not only get the workforce that they need, but they can live in a place that they will come to love. Next, some good infrastructure news. First up, in the last week, as part of our Better Kentucky plan, we presented more than $14 million in water and sewer projects in Magoffin and Johnson counties to support construction in this part on the local area vocational education centers. More than ever, we need a skilled workforce to support these job announcements and taking our place at the front of the line in the post-COVID economy. Now, these career and technical centers are absolutely critical to getting us there. And most of them were built in the late 70s. And as I said at one of these events, I know the wear and tear that can occur if you've been around since just the late 70s. But when you think about how our economy has changed and the importance, by the way, this is the first time that kid had ever held $10 million. He almost dropped it. When you think about how much the workforce has changed, we got to change those facilities too. We got to make sure our kids have the most modern technology because a factory is a totally different place than it was 20 or 30 years ago, and the skills are different. So next, on the infrastructure, we cut the ribbon on a new bridge into downtown Russell in Greenup County, which is opening this month. This is a $24 million transformational project that's actually going to be the gateway into their city, and it replaces a 1930s era viaduct bridge and provides a signature way to enter this really special town. It is the end of a 10-year project that my dad started with the governor of Ohio that created a bridge just down the road from it, but now provides the infrastructure to Russell, we think, to truly thrive. And it's going to be a breathtaking drive as you come across that thing. You can see the bridge over to your right, and then you can see the city that you're entering right in front of you. So it was an exciting day. In Boyd and Greenup counties, we were able to award $1.1 million to deliver clean drinking water and improve sewer and water infrastructure. Again, these are part of that Better Kentucky plan, which tries to realize our value, that clean drinking water is a basic human right, and it ought to reach every single family and every single household. On top of that, we work to become more resilient. Especially the Boyd County area, really the whole area was hit with ice storms, major flooding. In fact, I went to a warming center during the ice storm, and 2 weeks later, it was underwater. So we presented more than $800,000 in flood control funding for Boyd County, and then $530,000 in school safety funding for Greenup County. One, making it more resilient, hopefully less disruptions and loss of property and even life. And the other, these are discretionary transportation funds, and they've shrunk over time. But in many ways, that made us answer the question, what is most important to us? We are the best state at logistics in this country. We can get cargo anywhere in time for that company. But the most precious cargo we ever transport are our kids. My kids get in a car to go to school every day, and their safety going back and forth is paramount. So these dollars, which we're awarding, it's almost all the discretionary dollars that was provided to me in transportation, all going to school safety projects, and even did the analysis to determine where the most dangerous areas were, and we are correcting them. All right. So next, we have an update on flooding assistance for Nicholas County, and we have the county judge executive here with us, Judge Steve Hamilton. As Judge knows, I declared a state of emergency on August 3rd after the county received what seemed like wasn't even possible, 4.07 inches of rain in a 2-hour period, though I know some areas may have gotten even more than that. There was a period overnight from July 29th to 30th, so some people even woke up with their home already being devastated. It caused major flash flooding, resulting in numerous high water rescues, multiple road closures, and sadly, one fatality, one lost life of a Kentuckian. During this event, the rainfall exceeded the 1,000-year return rate. We had FEMA teams conduct damage assessments. Lieutenant Governor and I also toured the county to view the damage and to commit to help. We opened a multi-agency recovery center to assist residents of Nicholas County so they wouldn't have to go to 6 or 7 agencies. They could see everybody they needed to in one trip. And after all the assessments were in, we submitted the request to FEMA for a major disaster declaration. Unfortunately, it was turned down in large part because this was so localized and that program is designed for more regional disasters, and we appealed. But our appeal was unsuccessful. And at that point, it hurt to know that a county, an area that had had so much of its infrastructure and services wiped out, losing just about every fire truck, ambulances, and others, may go unhelped. So we knew those impacted were disappointed, and we looked for a way to help. We're talking about 88 homes, 29 businesses, as well as the city's wastewater treatment plant, fire station, and city garage that were impacted. Places that stored ambulances and fire trucks and other critical pieces that helped the county respond to emergencies were damaged, if not ruined, by this emergency. The estimated damages to roads, bridges, buildings, and equipment, along with the cost of debris removal, totals more than $3.8 million. We know it's an unusual situation, that there was so much devastation, but it didn't qualify for FEMA aid. And because of that, we wanted to look at every option we had to help. Most recently, I've asked the Federal Small Business Administration to issue a disaster declaration for Nicholas County. If approved, the disaster declaration would provide eligible business owners with low-interest loans to reopen Nicholas County businesses and employ county residents. That's an option that can help businesses get back on their feet. But today, we wanted to provide a little bit of better and immediate news. Today, I'm proud to announce that we're able to provide Nicholas County up to $1 million from our flood control program. These are funds that are used to assist local governments with flood-related projects. I know Judge Hamilton has been working to assess how the county can best use the funds to support local government, including possibly purchasing new emergency response vehicles. Judge, thank you for the work that you are doing on behalf of your residents. We wanted to try to find a way to help, knowing it's not enough, but it could help get the county, the city right there, back on its feet. Judge, if you'd like to say a few words, we're honored to have you.
Thank you, Governor. Good afternoon. I've come here today representing the people of Nicholas County, a tired and hurting people. As you're aware, our community suffered an unprecedented devastation in late July as ravaging floodwaters under cover of darkness floundered a path leaving behind death, destruction, and heartache. We lost a precious soul whom our community mourns. Over 80 homes, many businesses were destroyed and damaged. Many lost everything. And watched in shock and disbelief as homes were carried from their foundations and vehicles and treasured keepsakes were stolen by the angry waters. In our community, our infrastructure was shattered. Our sheriff's department lost 3 vehicles, a side-by-side rescue unit, and other valuable equipment. Our fire department lost 2 fire trucks, 5 were severely damaged, our ambulance service was completely displaced, and 2 of our ambulances were totaled and another damaged out of 4. Although our little community with a big heart aches, we haven't lost hope. We will not give up, and we are bound together in love of community, tradition, our hometown goodness, and desire to overcome. Governor Beshear, I would wish to publicly express a deep gratitude to you for your quick action and steadfast dedication to our county. By 8 a.m. the Friday morning following the disaster, the governor was immediately in touch with me, and we had submitted to him a declaration of a state of emergency. The governor has worked diligently along with his staff and our community to seek federal disaster aid, which would directly benefit individuals in our community. Regretfully, federal aid has not been granted. Today, I am truly humbled and with grateful heart that I accept on behalf of our community this bountiful grant of disaster relief assistance in the amount of $1 million that's authorized by the Governor Beshear. With these funds, I vow to oversee the process of rebuilding and reinforcing the essential infrastructure of Nicholas County. With your support, Governor, we will overcome, and please know that Nicholas County deeply thanks you.
We thank the judge for his leadership, which is never more important than in times of great difficulty. And seeing him amongst the citizens of Nicholas County, working with them was something truly special to see. And I know how hurtful this entire event was, especially the way it picked up homes and just threw them 15 feet forward. Many of which could never be entered again. Watching people basically bringing out every single one of their belongings, which had been destroyed. We hope this helps as we go on that path towards healing, and we hope to be able to provide help into the future in whatever way we can. All right, we'll now move into our COVID update portion, whereby I'll start and then we'll turn it over to Dr. Stack. First, just as a brief update, when we look at variants of concern and genomic surveillance in Kentucky, we are at about 100% Delta variant still here in the Commonwealth. We know that there's been a report of a Lambda in Louisville, but when we look at the overall, you call it a portfolio, but it's entirely blue. What we are seeing when we run the various tests, it is this dangerous Delta variant that is almost 100% of what's hitting us here in Kentucky. We don't have today's new COVID numbers. Those come out a little bit later, but I can tell you this week right now is tracking to be lower, but only slightly lower than last week. It does give us some pause about whether or not our decline is slowing. Certainly the curve of that decline, the slope will not be as significant this next week. Our hope is that is just a 1 week issue or incident, but I do think as we look through some of the graphs, which we will, what we'll see is the slope of hospitalizations, ICUs, ventilators is all starting to become less severe. It's starting to look like it may be approaching and or reaching a plateau. Let's look at hospitalizations for one. Now, as you can see, we had an incredibly steep rise. By the way, we still haven't seen all the ramifications of this much disease and this much hospitalization. We got reports and we reported deaths primarily that have come in during that time from local health departments and others. We are now starting to receive a lot of death certificates that will be on reports moving forward that physicians and others couldn't get finalized with so much work and being so overwhelmed. So we have yet to see the true toll on human life that the peak that we see there in hospitalizations caused. But I do want to point out it is still declining, and that is good. But we got to really watch the rate of the decline, which at the beginning when it started declining, it went down really fast, which we're grateful for. But it certainly appears to be slowing, and we will watch that. We'll talk about it again on Monday. Intensive care unit, again, the same. Again, it is continuing to drop, which is positive, but we're starting to kind of see a bend in the slope of that graph and in our numbers, and a little bit as well in terms of ventilators. What strikes me here is just how much higher the peak with the Delta variant for ventilators was as compared to the Delta variant, which is the other spike that you see there, a much more deadly variant, but thankfully had more people vaccinated and we had more tools to fight it, which we hope if we have any other surge in the future, more people are vaccinated and boosted, which I'm about to get here in a minute. But if we continue to do that and improve the way that we treat for COVID, again, we are better at fighting it each time that we'll have to. All right, vaccinations, getting back to being able to do some of the demographic reporting. As of today, 2,563,115 Kentuckians have had at least their first shot of hope. We are continuing to see daily numbers that are anywhere between 1,200 and 3,000, which means those are new Kentuckians getting vaccinated every day. We'd like to have a lot more than that, but hey, we are having people getting vaccinated each and every day. As we look at the breakdown, that is 57% of all Kentuckians. And remember, we just had an age group open up, which Dr. Stack will talk about, that we think there's actually a significant appetite out there, and we're going to have a lot of vaccinations. 12 years and older, this was the previous group authorized, 67%. So that's over 2/3 of everybody that can get a vaccine has gotten a vaccine in Kentucky. Remember, we've been at this less than 2 years. We all want to be over it. So we look at those numbers and say, what about the other third? Which is a good question. And we got to work towards that. But 2/3 of everybody that can be vaccinated in a 2-year pandemic where we've only had vaccines available for part of that, and then even less of that for the 12 to 15-year-olds. And the next number, we just hit a nice new mark, 18 and up. Those are individuals that can make their own decision. Now 70% of all Kentuckians vaccinated. Now, when some of the duplicates were in there that we didn't know, that we corrected, our number was higher than that. But listen, again, 70% of people have gotten the information they need. 70% have trusted in the science and have gone in and have gotten vaccinated. And more people are getting vaccinated each and every day. I think the lesson we got to take is we can't get tired. We can't get frustrated. Let's just keep going. Every new person that comes in is better protected. All right, as we break it down, 75 years and up, 88% of people. The next number I like better, but remember, that's 12% of 75 and up Kentuckians that have not been vaccinated, and those folks are at very serious and significant risk, even with COVID lessening. Okay, the next one, 65 to 74, 92%. I'll just say good job on that one. 50 to 64, 75%. And so, 50 and up, it's at least 3/4 of everybody when you go in that age group. And then we drop off a little. 40 to 49 years, this is my demographic, 2/3 of us. Remember, we're starting to see more and more deaths in this age range. Yesterday, we had 2 49-year-olds on the sheet of Kentuckians that we'd lost. 25 to 39, 56%. This next one went up a point. 18 to 24, 49%. 16 to 17, 46%. 12 to 15, 42%. I just want to think about the bottom two of those right now. So when school systems are starting to make decisions on what to do, just remember more than half of the kids are not vaccinated. More than half. So you got 20 kids in a classroom, you're going to have 10 that are unvaccinated. And so we need to think about these rates, and counties can break them down and see where they are even in that, in making those decisions. So we are going to continue to report this way, which is first shots. But obviously, in a minute, we're going to talk a little bit more about booster shots and why they're so important. But first, Dr. Stack is going to walk us through the great news that we have received, and that is the eligibility of kids 5 to 11 to now receive a vaccine that is tailored for them, that is less in amount, that even is packaged differently. And Brittany and I look forward to Monday when our daughter is going to get vaccinated, because we trust it. We trust the science. She wants it, and we want to beat COVID. Steve?
Thank you, Governor Beshear and First Lady. Good morning. It's nice to be here today. So exciting news that now the pediatric vaccine is available for children who are aged 5 to 11. There's plenty of vaccine to go around. So unlike when we did this in December and January, there will be plenty of vaccine so that every parent and every child will have the chance to be able to be vaccinated. There will not be all the vaccine on day one, but over the first few weeks, it'll very clearly escalate and be available very widely. So if you can't get in on day one or day two, just be patient. You'll be able to get in the first few weeks. I'm confident you'll be able to get vaccinated. These vaccines are very safe. They studied for the one trial that led up to the hearing for this, over 3,000 children, not a single one of whom in that study had myocarditis or any of the cardiac issues. There also were no other serious or major adverse events, and the children tolerated the vaccine with fewer side effects than the adults in the studies that were done for the adults. For your children in school, in addition to protecting them from the harms of COVID, and let's put this in context. First of all, thank goodness, children don't suffer hospitalization and death anywhere near the rate of adults. However, in the population under 18 in the United States, there have been more than 6 million children under 18 who have been infected with COVID. There have been more than 8,300 hospitalizations, and there have been at least 745 or more deaths in persons under 18 in the country from COVID. This vaccine, the Pfizer vaccine, is shown to be at least 90% effective in preventing symptomatic disease. If you think about that, of those 745 deaths, and no preventable death in a child is an acceptable death, we could have had perhaps 670 or more who would have been spared death and been with us today. So the vaccines are really important, and they will protect your child, but they'll also protect your family. People who are vaccinated are less likely to get infected and therefore less likely to transmit disease, which then keeps safer the adults in their household, their parents, their grandparents, and others with whom they live or engage. And remember, for your child in school, vaccinated persons who are exposed to someone with COVID do not have to quarantine unless they develop symptoms. So if you want to avoid quarantine and if you want to avoid testing, if you're vaccinated, exposure no longer triggers quarantine. Only actually getting symptomatic then requires quarantine. So it's a great way to protect your child, protect your family, protect your community, and avoid those other consequences that are necessary to keep people safe and ensure all children have the chance to be in school. The demand so far, at least anecdotally, is higher than even we expected. So that's fantastic. So again, I don't think you need to have a lot of patience, but please have a little patience as the vaccine gets shipped and deployed. Some sites take a few days after the federal government does its steps to put in place the clinical policies and procedures necessary so they can safely deploy the vaccine. This slide that's up here shows the purple vials are the ones that are for adults. So people who are over 12 in this instance, people who are under 12, it's a specific formulation. It's in an orange bottle. So for all the vaccine sites, and they know this, but just not wanting to ever assume anything, you have to use the orange bottle. You cannot dilute the adult version to make the kids version. We do that with a lot of medicines. You can't do it with this one. The other thing that they changed is this medicine in the orange bottle can be stored for up to 10 weeks in a refrigerator. This was done purposely to make it easier for pediatricians' offices, primary care offices, and clinics to be able to get the medicine, store it in their own refrigerators, not an ultra low cold freezer, and be able to use it over more than a 2-month period. So those are all wonderful developments. I'm going to mention just a few other things. Boosters for anyone who's been vaccinated more than 6 months previously. There's a large number of people who are eligible for boosters. If you're over 65 and older, you should all go get a booster right away. If you are over 50 and have any significant medical problems, you should go get a booster right away. If you are any age 18 or older and have major medical problems, or you are in you work in a setting where you're exposed to people who could infect you with COVID regularly or at a higher rate, you're eligible to get a booster. So just in the interest of clarity, because I know the CDC listens to the things we say, not everybody is authorized for a booster, but virtually everybody, by virtue of either your medical condition, your age, or the place you work, by attestation, is able to get a booster. So when you go to a pharmacy or a doctor's office or a clinic or a hospital or a public health department, and they ask you, do you meet these criteria? You just have to determine for yourself, do those criteria approve or apply to you? And if they do, then you say yes, and you'll be eligible for the vaccine. So again, use your judgment, but there should be no impediment to you getting a booster. And I recommend you get a booster if you are eligible under those criteria. A few other little tidbits. We are doing a lot of testing in K through 12 schools in Kentucky. So we now have 80% or more of all the schools in Kentucky, at least all the public schools that we have in a database, are now registered and using testing provided by the state-supported infrastructure for that. So there's over 1,200 schools in Kentucky, K through 12, who are doing testing supported by federal dollars, overseen by the grant program that the Kentucky Department for Public Health is operating. So thank you to those schools who are engaged, and we're actively working to get the rest of the schools on board. For the rest, we look forward to bringing you into this program and hopefully providing a wonderful service for you and for your children and for your staff. We've provided over 200 tests so far, over 200,000 tests so far this school year alone. So it's been a lot of work. And then the final thing, just anticipating this question, the Merck pill, the antiviral pill, has been approved in the United Kingdom. It's not yet approved in the United States. The hearing for the FDA for that, I believe, is scheduled for November 30th. And then after November 30th, if the FDA approves it here, then we will eventually find it available in the first week of December in the United States. And I want to caution folks, we've been told explicitly that the amount of drug for that will be very, very limited in the early months. I mean, so limited that maybe only a few thousand doses come into Kentucky, if that many. If that's the case, there's a lot of other reasons too, but you cannot rely on this medication as a way to say, I won't get vaccinated, I won't take precautionary steps, I'll just go get the pill. This will not be like Tamiflu for quite a long time. You can't just go get it anywhere. If you're a female, you have in your childbearing age, you'll have to have a pregnancy test probably to ensure you're not pregnant. You'll have to see a clinician who can evaluate you and determine that you have a positive test, you're not pregnant, and your symptoms started within 5 days. If you meet those criteria, the medication for the right people could be very, very helpful, but it's going to be a narrow and limited community who can get it in the beginning because it'll be limited in its availability, and it does require some evaluation for someone to be determined if they're eligible. So a lot of really good news. The governor's already shared the hospitalization data, the case data, all continues to look like it's improving, though now at a much slower rate. Please don't let your guard down. Temperatures are getting colder. The end of the year holidays are coming up. The best way for us to enjoy the holidays and be safe with each other and enjoy and celebrate these holidays in the presence of those we love and care about is for all of us to be vaccinated and be safe. And for those of us who have to be around folks who choose not to get vaccinated, the best way to keep ourselves safe, hands down, is to get vaccinated. So please get vaccinated, get boosted, and I sure hope you'll consider very seriously taking your children who are now eligible in to get vaccinated as well. Thank you very much. Thank you, Governor.
Thank you. It is great news to see that authorization. And folks, it means that you can get your kids vaccinated by Christmas. Both shots, having that immunity, being safer, getting together with parents and with grandparents. That's really important to us. It's exciting to actually see a couple people give us a call and say, I couldn't get in on the first day. And they're not upset about it. They're excited that other people are signing up at a quick rate. So just remember to have a little patience. Remember, we got to get through this together. And that means that everybody has to be able to get their kids in. And if you take your kid in and you haven't gotten yours, go ahead. Now's the time. You know, that loved one needs you around. And so please do everything you can. So getting vaccinated is important. Staying vaccinated, meaning having high levels of immunity, also incredibly important. I'm convinced that much of if we have another spike in the severity of what it will be will depend on how many of our people we have gotten boosted. We've seen in recent weeks that waning immunity is real, with a percentage of hospitalizations, vaccinated versus unvaccinated, changing over time. More vaccinated people being hospitalized with COVID, almost 30% last month alone. But what we know is that was less than 5% right after the initial round of vaccination. So we got to get back to that point. And so today, we brought Michelle back, who has become a friend despite sticking a thing up my nose to test me for COVID hundreds of times, to provide myself and the First Lady. And do we have anybody else or just the two of us today? Just the two of us? All right. You want to start or you want me to, Brittany?
No, I want to get one.
All right.
No, that's not what I mean. I want to get my booster shot
There you go.
so that I am safe.
So this is Michelle Searcy, the school nursing supervisor at Franklin County Health Department, who is administering our booster shots today. You know, she's been on the front lines of the pandemic since day one, and we've gotten to know her well over these past 19 months. She and her colleagues have done an amazing job. She's going to make sure that you got all that immunity you need.
She is so good at this. I barely felt that.
So she has a trick with kids where she says 1, 2, and then gives the shot. I'm not sure how fully honest and transparent that is, Michelle, but it does work.
It works, doesn't it?
Yes. As I cling. All right. I laughed that this is the first shot in my life I'm really excited to get. Whether it was the first or the second or the third. Yeah, but they're filming. All right. Thank you. All right. We even have the Band-Aid.
All right.
Why don't you do this next part?
Oh, yes. We're not quite done with you, Michelle.
Oh.
Well, Michelle, she's the school nursing supervisor at the Franklin County Health Department. And as Andy has said, we have gotten to know Michelle very well. And she has been wonderful through this pandemic for our entire family. And, well, let's see. This is what. Okay.
Start right there.
All right. So, you know, one of the things I've gotten to know about Michelle is how special you are. She is caring and thoughtful, and she absolutely embodies what a frontline healthcare worker is. And that is why not only is she the Beshear family's favorite nurse, but we are also proud to name Michelle and her colleagues at the health department as our Team Kentucky All-Stars today. So on behalf of us, Andy, Brittany, Will, Lila, even Winnie, and the entire Commonwealth, thank you for your dedication and for all that you've done and all that you continue to do.
Thank you.
Hey.
Thanks.
Yeah.
Yeah.
I just represent my team.
There you go.
It's been good.
You want to say anything? Come on.
No,
Okay.
absolutely not.
Yep.
You know that. Nope,
Thank you.
nope. Thank you.
All right. We'll open it up to questions. I think we got 4 journalists here. We got 4 with us virtually, and we'll start with Karen Czar back in person.
Hi. 2 questions for you and/or Dr. Stack. How much do you anticipate? Nationally, they're hoping by the end of the year, 75% vaccinated in the country. What do you anticipate Kentucky's numbers could be? And then some parents that I've interviewed have said their child already had COVID, so they really don't want to vaccinate yet. For people who are on the fence,
Yes.
what do you say to that?
Well, the science is very clear that if you have had COVID, you still need to get vaccinated. The level of immunity provided by the vaccine is so much higher than anything you would get by having COVID. And if you truly want to test that, talk to someone who has had COVID multiple times, because there are folks out there. The Delta variant came as aggressive as it was getting people that had cases of the original or of the Alpha variant. The science is certain there. We need those kids to get vaccinated. Where will we be by the end of the year? In Kentucky, we won't be at 75%, but with a whole new area, age group being able to be vaccinated, I think that we will see a significant improvement. I believe that we'll be over 60%, and I certainly hope being at 56% of all Kentuckians now. I think we will have enough vaccine in the first week and a half for about 1/3 of all kids in the 5 to 11 age group, and enough for everybody within probably 3 weeks or a month. Carolina.
How important are these booster shots essentially? Like if a good chunk of the vaccinated population does not receive them, where does that put Kentucky?
So the booster shots are incredibly important in getting our level of immunity back to a place where you're less likely to get it, you're less likely to spread it. It would mean that if we had another rise in COVID, there'd be fewer people that would be getting infected and spreading that infection. It will also lessen the person who has gotten the boosters likelihood of being hospitalized. And so it will further decrease the death toll. It's hard to project because we don't know the next thing that'll hit us and what it is. I certainly pray that we have seen the worst of it, but we have to be prepared. And everybody who has gotten vaccinated will have some level of protection. But the higher the level of that protection, the harder it's going to be for any next variant to break through and to cause us harm. In many ways, if you remember the graphs we showed on Monday, if we can get back to the point that we were right after the original round of vaccines, that is a heck of a lot of protection. And think about how many more people have gotten vaccinated now. Now, it's not as, in many ways, it's more linear when we were first doing it. Number of people, they're vaccinated and there's protection. We got a lot of people that have gotten vaccinated, but it hadn't been 6 months, right? So they're not eligible for their booster. So it'll be, the analysis of how it goes will be a little complex. Partly will probably be on feel. And I think on Monday, we're going to have our first numbers of boosters that people have gotten in Kentucky. I do think that they've been popular, especially amongst older Kentuckians who absolutely, definitely need to get the booster because that's where we saw the breakthrough deaths in the oldest of Kentuckians. And we believe these boosters are going to prevent that. Tom.
Speaking of older people, I've got a question of, there are 11 states, including Ohio, Indiana, and Illinois, who are reporting a huge shortage of snowplow drivers for this coming winter season.
Hmm.
And I was wondering if Kentucky was having any issues along those same lines. Ohio's at least 100 short.
So I have not been made aware of any shortage, but I'm going to go call Jim Gray, given all those other states have them, and make sure that is not the case. We need to be ready. We get hit by all types of weather in Kentucky seemingly every year. That's one of the reasons that flooding resiliency money is so important. And we got to think more about resilience as we move forward. The quality of how we're building our roads and our bridges, the materials that we're using, not just the expense, but how long they're going to last. The level of disruptions that we've had based on weather events, they're too much. And this is the type of planning that can hopefully reduce them. Chelsea.
What is your response to Biden's latest announcement that companies with more than 100 employees have to implement a vaccine mandate by May forward or require routine testing? And then what impact do you think that will have on Kentucky's already struggling economy?
So first, I think Kentucky's economy is surging. We have some challenges, workforce being one of them, but we would have prayed to be where we are right now a year ago in this pandemic. We've broken every record for new investment. Wages are going up. We're still dealing with some supply chain issues that are causing inflation. It's the supply chain that will work itself out causing that, while at the same time we're getting all this great investment that will be more permanent. But on the what they're calling a vaccine mandate, we believe that we're going to get the final rule today. The U.S. Department of Labor is going to talk about it. I truly do not believe that it is a vaccine mandate. It may be popular to call it that in Washington, but it is a testing mandate. The level of which you have to be tested, or whether at all, depends on whether you're vaccinated. We believe that Kentucky is going to fall in their definition of a major employer. And so we believe that as a state, to comply, we will have to test any unvaccinated state employee once a week. So if that becomes the reality, we're putting together the apparatus to make that happen. We do have some idea of where we are in terms of vaccinations because we offered a day off. And so how many people claim the day off gives us a little bit of an idea where we are. I think we're probably at about, I think we're running slightly above the rest of the population, but right about there. Some of our areas, like our psychiatric hospitals and our corrections officers already are tested once a week, if not vaccinated. But as things stand right now, we believe we'll fall within the rule, and thus we'll have to implement that testing procedure. Stu Johnson, WEKU. Saw Stu in person yesterday.
Thank you. Yes, sir. Appreciate your time today. And I think this question may be for Dr. Stack. Unfortunately, we are still seeing deaths. You mentioned today 2 49-year-olds that have passed from COVID. Why is that happening in terms of those under 50? And is it almost entirely in the unvaccinated?
So thank you for the question. It's a good one. First of all, just to prepare people for this, there will be sustained and elevated numbers of deaths reported for the weeks to come and probably through the end of the year. Remember, we had an enormous surge of a really dangerous variant, and a lot of people got sick really fast. The velocity, the rate at which this increased was like a rocket straight up in a vertical climb. And that happened really fast over about 2.5 to 3 months. And so people get sick, people go in the hospital, people who unfortunately die. And then it takes time for death certificates and reporting to happen. And remember, the public health workforce is overwhelmed just like the hospitals are overwhelmed. And so now that system, which normally doesn't operate this rapidly, is going to be processing the aftermath of this horrible surge we just had in the months ahead. So the first thing is just to prepare folks. The governor will be up here announcing, unfortunately, higher deaths over weeks to come, but that is part of the journey we have just now begun to emerge from with the Delta surge. So that's the one thing. For the deaths under 50, there are, I don't know the exact numbers, less than 10 of them. 95% or more of all the deaths under 50 are in the unvaccinated population. I think it's fair to characterize if you die from COVID under the age of 50, it in a way isn't a tragic and optional death. It is an option that was chosen because one chose not to get vaccinated. So under 50, those deaths are very rare, and it's almost all unvaccinated. Even when you're over 70, it's still 2-to-1 odds. Now remember, lots of people over 70 have multiple medical problems, and those are the people who are most vulnerable, but it still reduces your risk by at least 50% of having death if you get real sick from the virus, even if you're in advanced age over 70. So hands down, the vaccines, the data still shows are working wonderfully, but the governor's absolutely spot on. You got to get vaccinated if you're eligible. Now it's your choice, and you still have protection at some level if you're not boosted. So thank you for doing that. That's fantastic. But if you have a chance to get boosted, that's how you get your protection up over that 90% again, to make sure you don't have these risks.
And this is the chart we show from time to time on that exact question. You just look at the age group 40 to 49. We've lost 194 unvaccinated people to COVID during this period of time. We've lost 3 vaccinated individuals. So almost entirely unvaccinated individuals. Sarah Ladd from the Courier-Journal.
Yes, thank you. Can you talk a little bit about how the state distribution plan works? Was it deliberate to ship pediatric vaccines directly to doctors, since surveys have suggested that parents and guardians might trust them a little bit more? Thank you.
So we shipped are shipping to as many pediatricians as sign up. They have to sign up with all the federal forms. Now, there are a number of pediatricians that are opting not because they don't believe in the vaccine. They do, but because there's already a separate apparatus set up all over the country of providers. And remember, we've provided this vaccine differently than you get your other vaccines because of how fast we wanted to get it out and how many people need to take it. So a lot of pediatricians will have it right there. A lot of them will talk to families and then help them schedule it at CVS or the rest. I mean, remember also that typically a trip to the doctor is followed by a trip to the pharmacy with that prescription that they hand you. So the ability to get it all done in the same day with your typical and normal movements is still there. Our goal was to have as many providers ready as possible, and school systems themselves are coming on line with different vaccination clinics. Again, if they so choose. The decision to do it now is a little different than in the past because we have so many different providers that are set up, all receiving these. So during your day, if you go to the grocery store, you can get your kid vaccinated. If you go to the pharmacy, you can get your kid vaccinated. At many of our community centers, you can get your kid vaccinated. So many different options, but a lot of pediatricians will have that option for them too. Lawrence Smith, WDRB.
Thanks, Governor. A number of counties have dropped into the orange now, and school districts are either relaxing or looking at relaxing their mask mandates, other mandates, especially now with the child vaccine available. What do you think the threshold should be to do that?
Well, certainly we should give enough time for kids to get fully vaccinated. With it taking the 2 shots 3 weeks apart and 2 weeks after that to reach the full vaccination, that's 5 weeks from the first day it's available. And to say we've got a vaccine for kids now, so we're going to drop masks before they can get the immunity that the vaccines would offer would be a mistake. Listen, I think we got a good shot at getting to a place with this virus where we won't need masks in school, hopefully during this school year, but we will not get to that place if we rush the decision. Remember, orange is still a bad color, right? You want to get to yellow or preferably green. It used to be when we reached orange, we were scared, and we should be with the way that it spreads. So, this is a lesson in patience and perseverance. Listen, we've already made the tough decision, these school districts, to require masks. This is the largest gatherings of unvaccinated people anywhere in the state, the way it happens in poorly ventilated rooms that you are in for a long period of time. All that's important to me as a parent for the health of my child. But what it's also important is keeping my child in school. And it is very simple under the science. It's very simple looking at the probabilities that continuing universal masking in schools right now maximizes the chance for our kids to be in and stay in school each and every day. They've done that at my kids' school system. One of my children has missed one day. That's total between them based on this pandemic. This thing works. And I'd ask people to be patient enough to give time for people to get vaccinated first. And then really think about the kids that, might not end up getting vaccinated for reasons that are outside of their control, and how we think about and deal with that. Last, Melissa Patrick, Kentucky Health News. Oh, wait, Joe, we'll hit you after that. Sorry, you were not on my notes. Sorry. Go ahead, Melissa.
Thank you. The Attorney General today, along with Ohio and Tennessee, filed a lawsuit challenging Biden's vaccine mandates for federal contractors, calling it unconstitutional and federal overreach. So I'm just curious if you support this lawsuit and you're thinking about it.
Yeah, I haven't read it. Any of these steps ultimately get filed and go to court. And, I'm not going to begrudge anybody who wants to file and have their arguments heard. We'll see. Thus far, the Supreme Court and most of the federal circuit courts have been supportive of the constitutionality of different vaccine programs and or especially in federal court, other steps taken to combat the virus. Once you get to that appellate level and then at the Supreme Court level, they seem to have been supportive. I don't know the nuances of this lawsuit. In the end, we got to follow the laws of the state. And so we will prepare to comply with anything that's out there. And if a court tells us differently, then we'll look at our options then. Joe.
So I want to ask about the kind of rate of new cases that we've been seeing. I know the numbers have been declining for a while, but a lot slower decline the last week or so. I think the positivity rate is hovered around 5% or so. I know you talked a little bit about the concern that we might see cases tick up as winter comes and that sort of stuff. But how concerned are you that we might be getting, I hate to use this phrase, a new normal, but how concerned are you that numbers might be kind of, staying at this consistent pace of new cases? And what if that's the case, what would that mean for productive hospitals?
So our declining cases, you're right, are still declining, but the rate appears to be slowing, though we do have a small sample size. Before we've had 1 week close to another week and then a drop again, but it's enough to really watch. I'm not sure I'd use the word concerned yet, but we're paying very close attention to it. And you're also right that almost every day, with the exception of probably 2 for a month, the positivity rate hasn't just dropped every week, it's dropped every day until the last 3 days, 4 days. Again, sample size is really small. And the other thing about positivity rate is fewer people are getting tested at the moment too, and that impacts it. It's both how many people are getting COVID and how many people are getting tested. So again, we're watching it carefully, but there's a lot at play now. In the very first of COVID, we were talking about St. Louis and Philadelphia. There were just a couple metrics to really look at. Now you have vaccinations and people getting vaccinated for the first time. Now we also have boosters, being able to push your immunity up. Remember, it was still wintertime when we got the first round of vaccinations, and we were seeing, as that went on, the cases plunge. We have new folks that can get vaccinated. This group opening up, we have better treatments against COVID now, though you don't want to have to get an infusion when you can simply get a vaccine. So, and it's thankfully, where we'll go or what a normal would look like if COVID tried to stick around is a little more complicated than in the past. But every breakthrough we have, every innovation, every new group that can get vaccinated, every new treatment is a positive thing, which will hopefully mean we are ready or more ready. We're actually starting to see some of the major treatments being done after exposure, as opposed to testing positive with some older Kentuckians. So we're getting better in real time at dealing with COVID. What I would say is we are kind of letting our guard down a little bit in big gatherings, and I get we want to be there, but big gatherings indoor, it might be worth putting on a mask just to make sure you don't bring COVID home to your family. So we're still going to be learning on this thing in the near future. But if we can get boosted, if we can get a whole lot of kids in this age group vaccinated, we will be better off than we have been probably since vaccines were first offered. All right, we are at an hour. Thank you very much, everybody. We'll be back on Monday, and then we'll be able to look at that week over week, see where we are. Thanks.